afternoon, everybody. My name is Lief Fenno. I'm a psychiatrist and neuroscientist. I treat opioid use disorder, opioid addiction. Welcome to a docuseries sponsored by the American Psychiatric Association, where our mantra is treatment everywhere by providers anywhere. And today we're working with Mike Sasser, a paramedic with Travis County. So, Mike, tell us a bit about your treatment program here in Travis County.
The way our program kind of starts is like every time somebody experiences some kind of overdose that interacts with the 911 system, that name generates on a report that I see daily. And then we evaluate that report and find out if that's somebody who looks like they're struggling with substance use or actually has a problem. And that's why the Narcan was used. That's when we send somebody out to follow up with them. And we always start with the conversation with, hey, are you okay? Because that's really what it matters for us, is like just checking in with somebody to figure out, is there anything that we can do? And sometimes, and lately, it's when we follow up with people, that overdose and that conversation kind of brings us back to the conversation around fentanyl. And we take the opportunity to have a conversation about harm reduction, provide Narcan, provide training, provide advice about not using alone, testing your drugs. And then we evaluate whether or not somebody actually has a problem and it's a medical situation. I always address that by asking, use every day and do you get sick when you stop? If the answer to that is yes, I know what the life looks like. I know that it's just this constant roller coaster of pain and trauma. We offer connection to programs or inpatient programs or whatever it is that people think that they're going to need to get sober and get their life back together and get everything under control. And so what we do is we offer buprenorphine treatment. We'll start somebody when they're ready, provide medication. We'll do an induction at home or wherever we may need to be when we do that. And then we will provide daily dosing until they can connect to another program.
Mike, when you meet people in the field and they've just had an opioid overdose, how do you describe Narcan and buprenorphine to them?
So when I talk about Narcan, I always describe it kind of as the fire extinguisher for people who are playing with fire. Like if we're involved in the situation, then it's probably a situation where somebody was messing with something, put them in a dangerous place. And when you think about it from a public safety perspective, we say that fire department has fire prevention, and everybody understands the concept of fire prevention. The difference between us and them is we do that for humans. So that's kind of how we evaluate how Narcan works, is we talk about people like, this is prevention, this is going to keep you alive, this is going to save you when something terrible happens. And then as far as the buprenorphine goes, we're trying to turn ourselves back into that medical mindset, and it needs to be managed like a chronic disease. And the best way that I found to make people understand what buprenorphine is and how it works, manage your opioid use disorder the way that people learn to manage diabetes. And I draw comparisons between how diabetes is managed and how methadone works and how buprenorphine works and how glipizide works and how insulin works. And so we talk to people about that kind of thing. So we use that opportunity to explain the medical side of it.
So you're a paramedic, but you're managing Suboxone, buprenorphine. How did that come about?
I wanted to give people Narcan and save somebody's life. Once I started giving out Narcan, it took about a week, and then we started trying to figure out more than that. And every overdose follow-up that we would go on, we'd have a conversation with people saying, hey, what do you need to get sober? Like that conversation always leads you back to meds, right? Especially when it comes to opioid use disorder, because without medication, opioid use disorder, the relapse rate's over 80%. Because the relapse rate is so high, we were trying to get people into programs. Well, it takes about a week to get most people into a program. Like the clinics are great and they work really, really hard to try and squeeze people in and fit the schedule, but there's limited space in your clinic. So we were like, well, why can't I just give that medication? I'm a paramedic.
So you start patients on buprenorphine, you give them Narcan, and then what happens between that point when you first meet them and when they get into a clinic?
Currently, our average is about 4 days to get somebody into a program. First day I'm with somebody, I'm going to do an induction and we're going to spend an hour and a half to 2 hours with them, making sure that we establish the correct dose for them. And then the next day is follow-up. And then we come back on the second day and we do the follow-up. We're like, okay, let's see how the medication made you feel. How did you do last night? How did it go? Do we need to take your dose up? Do we need to take your dose down?
It seems like it's filling a big gap in the treatment continuum.
I feel like it is, because before we had the option to be able to treat people, there were so many times that we were frustrated because we were trying to get somebody in and we had multiple people who literally died waiting to get into treatment. We also had people who were just give up, right? If you had to tell somebody who's in a bad place, who's having to use every single day just to stay well, then you tell them like, okay, we'll get you in next Thursday. And they're like, okay, well, I guess that's not going to work out. And so they give up. When I go follow up with people on the overdose side, the conversation is, if you're not ready in this moment to start right now, you call me whenever you are, and I will come meet you whenever you are, whenever you're ready. Because we have 24-hour coverage now. So I have somebody I can send 24 hours a day to respond when somebody calls 911 for opioid withdrawal.
Mike, as a paramedic who's prescribing buprenorphine, I'm curious what you would say to other medical providers who might be nervous about using this medication.
When it comes to like managing this medication, if you pay attention to what you're doing, you respect the story and where people are coming from, and stop and listen to your patients and understand what they're at, where they've been, and be honest with them and let them know like where this could go. And as long as we've been very conservative in our dosing,
what would you say to patients who are nervous about starting this medication?
At that point, I'm like, why are you nervous? Like, what is it you're concerned about? Like, is it a matter of you're afraid you're going to make yourself sick because you had a bad experience? And let's explain why you had that bad experience, that it is a competitive agonist, but we, of course, explain it in terms the patients can understand a little bit better. And to explain it that way, if it's a matter of I don't want to get addicted to something else, then that's a whole different level of conversation where we start talking about opioid use disorder as a medical condition and what it actually means and what's going on within their brain chemistry. But again, finding ways to make it work.
Well, Mike, thanks for coming out today. If people wanted to get in touch with you or with your program to learn more, what would be a good way for them to do that?
Look up Austin Travis County EMS online. We also have a duty officer phone number. Just call 911 in town.
Well, thank you very much. Thank you for coming today. We're here with Mike Sasser, paramedic, who really embodies the idea of treatment anywhere by providers everywhere. Thank you.